Look at your nails right now. Not to check if they need trimming. Really look at them. The color, the shape, the surface, the base where the nail meets the skin. Because your fingernails are one of the most precise diagnostic windows in the human body. Doctors in cardiology, pulmonology, endocrinology, and hematology all examine nails as part of a clinical assessment because nails reflect what is happening in your organs, your blood, and your nutrient levels with remarkable accuracy. In this episode of Body Warning Signs, I'm going to walk you through 6 nail changes that are extremely common after 60, what each one means, which organ or system it points to, and exactly what to do about each one. If you missed episode 1 on tongue color or episode 2 on swollen ankles, those are linked in the description, and I highly recommend going back and watching both. Each episode in this series gives you a new language for reading your own body.
Before we go through the signs, let me explain why nails are such a reliable indicator of internal health. Your nails are made of keratin, the same protein as your hair. They grow from a matrix of cells at the base of the nail, and that matrix is fed entirely by your bloodstream, which means every nutrient deficiency, every circulation problem, every oxygen issue, and every hormonal imbalance leaves a record in your nail as it grows. Nails grow approximately 3 millimeters per month. A nail change that appears halfway up your nail happened about 3 months ago. A change at the base happened recently. Your nails are essentially a timeline of your internal health going back 6 months. This is why doctors don't just glance at nails. They look at where on the nail the change appears, how many nails are affected, and whether the change is getting better or worse. All of that tells a story.
Sign 1. Clubbing. Clubbing is when the fingertips enlarge and the nails curve downward over the tip of the finger, like an upside-down spoon. To check for this, place the backs of your fingernails together from both hands. Normally, there should be a small diamond-shaped gap between the nails. If that gap has disappeared, if the nails meet flat, this is a positive Shamroth sign and suggests clubbing. Clubbing is one of the most clinically significant nail signs. It develops when the tissues at the fingertips chronically receive low oxygen levels. The most common causes in seniors are chronic lung disease, heart failure, and in some cases, inflammatory bowel disease or liver cirrhosis. If you notice clubbing, especially if you are a smoker or former smoker, this warrants a chest X-ray and pulmonary function test as soon as possible. Sign 2. Yellow nails. Yellow discoloration of the nails in seniors has 3 common causes, and knowing which one you have points to completely different solutions. The most common cause is a fungal infection, onychomycosis, which causes yellowing, thickening, and crumbling of the nail, usually starting at the tip and moving toward the base. This affects up to 20% of people over 60 and is chronic and progressive if untreated. The second cause is lymphatic dysfunction, the same system we discussed in episode 2. Yellow nail syndrome involves yellowing of all nails alongside slow nail growth and often coexists with lymphedema and respiratory problems. The third cause is chronic respiratory disease, particularly in smokers or former smokers, where reduced oxygen and circulation to the extremities causes gradual yellowing of multiple nails simultaneously. Sign 3. White spots or lines, leukonychia. White spots on nails are one of the most misunderstood signs. Most people have been told they mean calcium deficiency. This is almost always wrong. True white spots, called leukonychia, are almost always caused by minor trauma to the nail matrix. Bumping your finger, pressing too hard during a manicure, or even aggressive handshaking can cause a white spot that appears weeks later when that part of the nail grows out. These are harmless. However, white lines running horizontally across multiple nails simultaneously are different. These are called Mees lines, and in seniors, they can indicate heavy metal exposure, arsenic or thallium toxicity, or serious kidney disease. Single nail, single spot, almost certainly trauma. Multiple nails, horizontal white lines, worth investigating.
Every week, your body is telling you something. Most people just don't know the language. That is exactly what this series is here to change. Episode 1, your tongue. Episode 2, your ankles. Episode 3, your nails. Each one gives you a new diagnostic tool you can use at home in 60 seconds. Next week, your eyes.
the whites, the pupils, the lids, and the skin around them, because each of these reveals something completely different, and some of what I am going to show you next week will genuinely surprise you. Subscribe and hit the bell so you don't miss it.